Okay, so just a little bit more about opioids. This includes opium, morphine, and heroin. It's derived from the plant Papaver somniferum. So, as you probably know now, opium has had a long history of medical use for pain relief, anxiety relief, reduction of symptoms from dysentery, so diarrhea. It likely originated in the Middle East, so about 1500 BC. It comes from the opium poppy plant, which you can get opium 7 to 10 days of the plant's entire life, which is about a year long total. So, from the time the flower petals drop and the seed pod matures. It also had importance in Greek medicine as a cure all, and then reached Europe in the 16th century. Dr. Thomas Sydenham was called the English Hippocrates, and he's quoted saying, "Without opium, the healing art would cease to exist." The next large historical event that happened with opioids was the Opium Wars between British and China, or the British and China. The British went to war with China so that they could keep pouring opium into the national government, even though the emperor and China's government outlawed it. So then in 1806, Frederick Serturner isolated the primary active ingredient in opium, which is morphine, and it's about 10 times as potent as opium is. And the invention of the hypodermic syringe in 1853 by Alexander Wood and the wars that were occurring from 1861 to 1870, which included the American Civil War and the Prussian Wars, resulted in a huge increase in the use of morphine. So this is because, one, it was more efficient to administer the drug intravenously because you got better effects and faster effects that way. And then the wars resulted in a whole lot of soldiers that were suffering from pain and dysentery. So then in 1874, two acetyl groups were attached to the morphine molecule, which resulted in heroin. And this was legal for sale on the market by 1898 by Bayer companies. Heroin is about 3 times as potent as morphine. And all of these drugs, if you use them continually and frequently, then they do lead to physical dependence.
Okay, so just a quick recap of pain receptors and their signals. So basically, it goes from the nociceptors down to the primary afferent neuron, which takes the signal to the dorsal root ganglion, which carries an electrical current that causes the release of neurotransmitters up to the secondary excitatory neuron, and then up to the brain and so forth. So what we know from now is that opioids inhibit pain signals at multiple steps of the signal pathway. So they work their way in the brain, spinal cord, and periphery. And in the brain, opioids have mood-altering effects, cause sedation, and decrease emotional response to pain. Opioids block signals from the primary nociceptor to the secondary neuron, and they also work on neurons that descend from the brainstem to the spinal cord that function to modulate pain signals. And those pathways have fibers that amplify or inhibit pain signals being sent to the brain opioid compounds. So we know basically that opioid medications are so effective at treating acute pain because they attack it from every neurological angle. So just a quick chemical overview. From the synaptic cleft, the entering of calcium ions cause a release of neurotransmitters into the synapse, and from there the calcium ions float across, then bind with receptors on the postsynaptic neuron. And then lastly, opioid receptors on both synapses. Then, when an opioid compound attaches to the receptor, it decreases the amount of calcium ions being entered, decreasing the amount of excitatory neurotransmitters.
So, as many of y'all know, we're currently experiencing an opioid epidemic in America now, which has been called the biggest drug crisis in American history. Death rates now rival those of AIDS during the 90s, and drugs now kill more Americans than cars do. In 2014, there were 29,230 car deaths, and in the same year, there were 47,055 deaths by drugs. This epidemic has been growing for years, but has now gotten to the point where it is a major issue. And this is due to the fact that in 20 years, the opioid prescription numbers have tripled. According to the National Institute of Drug Abuse, there are now 219 million prescriptions which were written for opioids. This rise was made all the more dangerous when drug cartels from Mexico flooded the U.S. with heroin. This is dangerous because the heroin is a street version of prescription opioids. Heroin tends to kill the younger people, whereas opioids kill older people. There are 12 states in the United States that actually have more opioid prescriptions than they do people, and those states are Alabama, Tennessee, West Virginia, Kentucky, Oklahoma, Mississippi, Louisiana, Arkansas, Indiana, Michigan, and South Carolina, and Ohio. So there is really no rhyme or reason as to where this epidemic is occurring the most, but doctors in these states have way overprescribed. Um, this drug, opioids, is very addictive. So after the people's prescription run up, they take to heroin, which is not near as controlled, so it ends up with more deaths. And then just a couple of numbers from 2015. 12.5 million people misused opioid prescriptions. 2.1 million did so for the first time. 2 million have a misuse disorder. 33,091 died from opioid overdose. 15,281 overdosed on commonly prescribed opioids. 828,000 used heroin. 9,580 deaths because of synthetic opioids. 135,000 used heroin for the first time. 12,909 people died because of heroin. And overall, it cost the United States $78.5 billion.